Good evening from New York. I'm David Schuster sitting in for Keith Olbermann. There are 5 health care bills in Congress, 3 in the House, 2 in the Senate. 4 have made it through committee so far. All of them include a public option that would let Americans choose a government health care plan instead of a plan run by a private insurance company interested in maximizing profits. Today in our 5th story in the countdown, the one committee seen as having the best shot at enacting its vision of health care into law took up the public option and shot it down. The smoking gun was in the hands of Democrats. The Senate Finance Committee had 2 versions of the public option to consider today. One of them, from West Virginia Senator Jay Rockefeller, would have cost the drug companies billions of dollars by paying less for drugs. The other, from New York's Chuck Schumer, opened the drug prices up for negotiation, among other concessions. Rockefeller's version was first out of the gate. Republicans, led by Ranking Member Chuck Grassley, raised a number of objections. One, of course, their objection in principle to any program run by the government, which Mr. Grassley tried to explain does not mean they oppose popular government health care programs like Medicare.
I'd just like to know what you think of Medicare, a government-run program that's far more government-run than what Senator Rockefeller has proposed. Do you think Medicare is a good program? Because most of the amendments on the other side have been aimed at preserving Medicare, a government-run program.
I think that Medicare is part of the social fabric of America after 40 years, just like Social Security is. And I don't say that because it's perfect. There's a lot of things that need to be changed, and a lot of the things in this legislation are changing a lot of things that's wrong with Medicare. To say that I support it is not to say that it's the best system that it can be.
But it is a government-run plan, isn't that right?
It is a government-run plan.
Thank you.
Republicans had other arguments in their quiver. Even if a public option by itself was a harmless or even a beneficial government program, it could lead to something bad. An argument they originally used when they tried to block Medicare and Medicaid. Today, when Grassley was challenged on how the public option would lead to a single-payer health care system, Mr. Grassley said the public option would lure so many people to it, private insurance would collapse. Although the nonpartisan Congressional Budget Office estimated only 8 million people will join the public option in the next 6 years, Grassley had memorized other statistics to justify his slippery slope argument, including one from the Conservative Heritage Foundation and one from, well, we'll explain in a moment.
Now, you just made a statement that it will lead to a single payer. Yeah. How in the world do you make that leap?
Well, you know, there are health economists around here, and I can only quote 2, but I imagine there's dozens you can quote. And the only reason I can quote 2 is because they're the only ones that I want to keep in my head to give people answers. But one is Heritage says that 83 million people are going to be forced out of their plan, employer plans, into public option. And Lewin Group says 120 million people.